Digoxin is a drug that is used for some supraventricular arrhythmias like atrial fibrillation or nodal atrioventricular nodal ventral tachycardia. The mechanism of digoxin is we have a cell. Here is the sodium channels. Here are the calcium channels. Here is the pump of sodium and potassium, and here is another pump of sodium and calcium. Alright, so this pump is taking out the sodium and putting in the potassium. So the sodium, when the sodium enters and there is a exchange with calcium. So natrium is going out, and so when natrium comes in through this pump, natrium comes in and calcium goes out. So if we block the sodium potassium pump, that is the action of digoxin blocking this pump, so there is no sodium getting out. If there is no sodium getting out, this pump will also be blocked because there is no gradient, and so the natrium is not entering the cell because it's already in the cell, and so it's not entering, and so the calcium is not getting out of the cell, and so the calcium remains in the cell. This calcium that remains in the cell increases the coupling, the contraction, the force of contraction, the contractility. So digoxin is positive chronotropic and is positive inotropic of contraction, and it has negative chronotropic. Is negative chronotropic. This is because increases the parasympathetic response in the atrioventricular node. So can also lead to some arrhythmias, but also it serves for terminating some arrhythmias. Now, the effect of digoxin is that the potassium is not entering into the cell, and so produces hyperkalemia. Now, the digoxin effect is worse, or the toxicity is worse, if there is less potassium, because specifically digoxin binds to the pump at the site of potassium, and if there is less potassium, more digoxin is going to bind. So hypokalemia usually is a poor prognosis. The treatment is slowly correct the potassium. For digoxin is giving FAB. These are some monoclonal antibodies, some antibodies against the digoxin. It is like if we are giving antibodies against a toxin like tetanus toxin, for example, and magnesium, because digoxin decreases magnesium, and this increases the risk of torsalis points. Remember that we use magnesium to treat torsalis points sometimes. So digoxin is positive inotropic, negative chronotropic, is used for atrial fibrillation or some other supraventricular arrhythmias, and the adverse effects are certainly the interaction of digoxin with other drugs that displaces digoxin. These mainly are verapamil and quinine. Also can produce constipation, yellow visual space, that is the patient see everything like in yellow, and this is very common sign of digitalis toxicity. In the electrocardiogram, the digitalis toxicity will look like like a spike in the QRS. This is the QRS. This will look something like this. This is how it would be in a ECG.